Hi, this is Diane Carbo with Caregiver Relief. Today we have Betsy Wurzel with us. Betsy is our dementia care specialist, caregiver coach, podcast host. She also has started the Facebook page, Kick Alzheimer's Ass Move. Betsy also has her own podcast, Chatting with Betsy. Betsy, I'm so excited we are talking about this. Actually, right before I got on the podcast, got a call from a woman from New Jersey who is doing research because they want to know what they have to pay for and what they don't have to pay for and what Medicare and insurance will cover for things. So today our topic is on how to avoid or stop surprise medical bills.
Hi, Diane. Thank you for having me on. Excuse me if I have to cough. The air in New Jersey here is very sick today. We're expecting Ida, but thank you for having me. Yes. Thank you. Surprise medical bill. I have to tell you a personal story. I used to have my husband's insurance, private insurance. My husband's company said goodbye when he turned 65. So I had to go on the Affordable Health Care Act, which is not affordable at all, and the benefits stink. So when I went for my stress test last year and opened up the bill, I had to grab my inhaler. I couldn't believe what it cost. Thank God I'm fine. What I did do, and I could recommend this, because somebody told me about this, you can't afford a hospital bill. There is charity. I didn't qualify for it. But it was the high time of COVID. And I said, I'm out of work. I can't afford this. Can you reduce it down? And they reduced it. I said, I need it reduced down more. And they let it go. And it was well over $3,000, Diane. I was floored. But when we get our medical bills, when you get it from your insurance, the insurance companies don't plan on you fighting with them or the doctor. But you have to make sure that your doctor or the facility that you go to is in your plan. I can't stress this enough. Doctors, hospitals, places, they come and go in and out of plans. You could call your doctor. They could say, oh, yeah, we take your insurance. And then you find out there, like in my insurance company, there's a tier 1 and a tier 2. If you go to tier 1, you just pay your copay for going to a doctor. If you're in tier 2, yes, your doctor is in the plan, but guess what? They don't pay for it until you reach your deductible. This is very important to find out before you go, because you will be shocked when you get your bill.
One of the issues that we have is we have too many different plans out there. If you have a Medicare plan with a supplemental, there's different levels. Most of those are usually covered, but the government's really pushing for us to do the Medicare Advantage plans. Medicare Advantage plans, while they seem like they're these wonderful plans because they'll bring you food and they'll provide you with dental and eye and all this and that, it's in fact, they're very limiting on when it comes to the medical care that you're provided. You have to understand your plan when you purchase a Medicare plan. Many people don't want to pay for the supplemental. I get that, but it gives you so much more freedom and availability for things. So you don't have as many surprises. You still get them, but they're very limited. I think that the Medicare Advantage plans that people are seeing, you're either an HMO, which is a health maintenance organization, or you're a PPO, which is a participating provider organization. And while the PPO, you may have lots of opportunity, what you said in the beginning of this call is what happens. Insurance companies don't always continue to have agreements with doctors or hospitals or even a specific practice or a specialist. So when you're having a surgery and you go to the hospital and you go to have the surgery and you say, oh, this is great, participating provider for the surgery, the hospital provides, great. But you don't know that the anesthesiologist isn't covered under your plan, or the lab that the hospital uses isn't covered under your plan, or even the pharmacy for the drugs isn't covered under your plan. It's very frustrating because, number one, we're aging. We don't have time for all this BS. But we don't. It's like, why should our golden years should not be us in the hospital all the time, in and out of doctors' offices, and then dealing with the insurance companies and the providers. But it happens all the time. A surprise bill of anesthesia can be very expensive.
Yes. Oh, yes.
And it's so you have to be like an explorer, an investigator, a detective, actually. You have to be a detective. You have to do research before you have anything done, especially if you're with a managed care plan like a Medicare Advantage, because they can be very limiting. If you're a person that travels, you definitely are going to have out-of-pocket expenses if you have an emergency, if you're on a cruise or something. Or you're out visiting your grandchildren in another part of the country and you become ill or have an injury or an accident. You've got to understand your insurance and know what you've purchased, because I'll tell you right now, it's an all too common situation. There are ways you can combat these surprise medical bills, whether they come from an emergency situation or as a result of being referred to for a procedure or something. It's better to prevent them in the first place, but if you can't prevent them, you better be prepared to take battle with your insurance company.
Yes, it's very important to know what your benefits are, and it's okay for you to call up your insurance company, question a bill. It's okay to call up your provider, which I have done many times, to their billing office, to call up and question before you pay. And I am finding that they are very incompetent. This year alone, I had to call up. They said that I owed my copay. And I said, no, I paid you my copay. I can't even see the doctor until I do. They won't even let you see the doctor. I had to pay it. I said, so what did you do with my check? Oh, I have to prove that I paid it. So I had to inconvenience myself, look for my check, and send it over. And I said, why don't you find out who's incompetent in that office?
Yes.
Because I got a big mouth now, Diane.
You and I both, you have to, in today's, with the present day medical delivery system, you have to have the strength and the energy to stand up for yourself, or you need to hire an advocate to do that kind of work for you. Perfect example is, I know people will say, oh, they get on the internet and they look at the online directory and they go, oh, everybody's covered. The majority of time, and shame on these insurance companies, but those directories are out of date and they're not kept up to date. So the physician or the anesthesia group that you think you're getting is covered under your plan is basically not. So I tell people, if you're going to have a procedure, talk with the billing department of your surgeon and ask them who's doing the anesthesia and who's doing any kind of consulting, if they're going to have consultants come in if you have a procedure done, because you want to know if they're in or out of the network. Even the radiology department, if they're not within the hospital but you're supposed to have an MRI or something done at an outside facility, are they presently covered? And you have to keep a notebook of who you've spoken to, the date and time you've spoken to that person, and a brief documentation in your notebook of what they said. Because it can change daily.
Yes, I even had my insurance company talk to the billing department, three-way call, a couple of times about a bill trying to get paid. They're telling me that I owe money and I don't. So they already were talked to. They already got the explanation of benefits, and they still don't get it. Oh, we didn't get that. Make copies. It's just downright ridiculous. I had to share another story. I'm due for a colonoscopy. I'm all long overdue, and an endoscopy. But you know what? It's a shame. I can't afford preventive health because with my insurance, they won't pay for an endoscopy. I have to pay the usual out of pocket. And with a colonoscopy, now this is a good one. I'm used to my husband's private insurance where they covered everything. With a colonoscopy, yes, if it's just a screening, yes, they will pay 100%. Mm-hmm. But if they take a biopsy, they consider it surgery, and I get to pay 20%. And my doctor's office didn't believe me. They said, oh, no, that's not right. And I said, no, I'm telling you, it is right. I will get charged 20%. Yeah. So even the doctor's offices, who they don't even know sometimes how crappy these insurances are. It's ridiculous. That you can't even afford preventive care because of how the insurance is. Now, I highly recommend to people, your senior centers, now with COVID, they might do it over the phone, but when my husband was going on Medicare prescription, I went to my senior center and they helped me because they're not in it for a commission. They're not a salesperson. Go to your senior center if you need help to navigate Medicare. Now, with the supplement that Matt had, we got through with his company. So he got a little discount his first year, which his supplement was wonderful, actually. They paid for everything. I didn't get any bills.
I pay for Part G through Medicare, the supplement, and it does cost me. But you know what? I can go anywhere in the country, be seen, and I just have the initial $185, which will probably be going up, the initial Medicare deductible that I start every year with. And that's really important that people understand that too, about the co-pays and the deductibles, when they kick in and what they don't. I also want to make people aware that even though your hospital may be part of your provider network with your insurance, if you go to the ER, the hospital may have an outside organization, which is usually occurs with the ER physicians, and they may not be in your network. So when you're going to the hospital and you're being seen in the emergency room, you can actually have the radiologist and the ER physicians in that hospital, maybe from a different practice that is not covered by your plan.
Yeah, that's a good point,
so it's so
Diana.
Convoluted.
Yes, that's crazy. If you're unconscious, you're an emergency, you don't have a choice, where to go. An ambulance takes you, God forbid you're in a car accident. And maybe you could fight that with your insurance, but it's getting more difficult. Also, Diane, people have to make sure they're billing to the right person. They might get your name confused with someone else's. Just the person who's registering them. Put in the wrong birthday year. That happened to me. That happened to Matt, actually. It was.
I was born Diane Smith. You talk about my dad when my mom was sick with cancer. We got bills that were to a Louise Smith that was not my mom. So I understand that totally. And that was 50 years ago.
Wow.
Not like it is now. It's even worse now.
Yes.
You were talking about going by ambulance. That's another thing. You don't even know if the ambulance in your area take you to an in-network hospital.
That's right.
That's a whole nother ball game that you have to think about if there is an emergency. And is the ambulance covered by your insurance? Because it may not be. That's another thing. So you really have to know your product that you've purchased. You need to be prepared for everything. If you're going to buy a Medicare Advantage program, find out what hospitals are involved with it, what providers within that hospital provide service, and check out your local ambulance company. Now, there are ambulance companies around where you become a member to the ambulance company for so much money a year. And then it's private ambulance companies. I don't know how that is working in all parts of the country, but I know it does in Pennsylvania, there were communities where you would purchase into the local ambulance company, and then you were provided the coverage was taken care of. Your insurance coverage was taken care of. They accepted whatever payment they got. But that, again, it's taking the time to do the homework beforehand. And it's very hard when you're not feeling well to do this.
Or caregiving.
It's very hard. Yes, absolutely. One of the things that people also need to do is make sure that the billing codes, and this is not our responsibility, but I'm telling you right now, the wrong billing code by your doctor's office can do terrible damage as far as surprises and medical bills.
That's right.
So I think that it's really important. I would ask when you're doing your research for your procedure, if you have an anticipated procedure coming up, like a knee surgery or hip, that you actually, or like you with your preventative care, is ask them what billing codes that they're going to be using, and then call your insurance company to say, what kind of coverage do I have under this billing code? And like you said, and I hear this all the time, that you can go in for a colonoscopy. There is not a doctor that does an endoscopy or a colonoscopy that rarely does not take and do a biopsy. They're going down there for a reason. They're looking you for a reason. They're looking for bacteria. They're looking for things or infection. So, of course, they're going to take something. So shame on these insurance companies for playing this game. It makes me crazy. Oh, we can't pay for that because it's a different procedure. It makes me crazy. So you should be able to understand that there is a medical code. It's like a specific 6-digit code, and it can determine the cost of a procedure. It can help you understand what may be fully covered or not covered, and what will result in out-of-pocket charges for you.
Yes, and I can testify that what you're saying, Diane, is 100% true, because I have encountered billing code problems, that they don't, do the right billing code, so that it costs more money. And this is where you have to speak up, because it can make a whole lot of difference. And when you go for an MRI or a CAT scan, make sure you're going in network. Make sure you know what the cost. I know with my insurance, I have to pay up front, whatever the cost is up front, or you don't get your test done. It's insane.
It's very frustrating, and it's hard because it's so convoluted, and it shouldn't be this convoluted. It shouldn't be. You have to make sure that you have the conversation with your doctor, too, to understand that he needs to or she needs to use in-network labs for blood work, MRIs, and other tests. So you may have to call your insurance company and say, these are the tests I'm having. Where is the local in-network lab or radiology center that will be covered under my plan? Again, don't trust that what they have online is true, because it could be out of date.
Very true. And don't trust the doctor's office either. I can't even say that enough. And they say, oh, yeah, we're in network. And you find out they're not, or they're at the lower rate, like I have, tier 2. And some of these doctors, be very careful. About 7 or 8 years ago, Diane, my husband's name was Matthew Sloan. We got a bill for another Matthew Sloan, who I happened to know who he was because we went to the same doctors. And it was kind of funny. No relation at all. And I got this huge bill for a rehab, and I called up. And I said, you had the wrong Matthew. And they wanted me to write a note proving it. And I said, no, you made a mistake. You fix it. I said, I'm a caregiver. At that time, I was working 40 hours a week. And they had the nerve to say to me, maybe your husband came here, you didn't know it. And I said, well, I don't think so, because my husband has Alzheimer's, and he doesn't drive, and I don't think he would walk 7 or 8 miles to your facility.
Exactly.
I thought it was fraud. And I called up Medicare, and I called up the United Healthcare, which is what my husband had at the time, to tell them this was fraud. I thought somebody was using his number. and they had to pay that all back. That was like $10,000, if not more, that they had to pay back. We can't be afraid to question something. Don't be afraid of a doctor's office or building department. And if you're not satisfied, ask to speak to their supervisor. Say, I would like to speak to your supervisor.
Well, you know me. I always say, why go to the ass when you can go to the head? So I always go to the supervisor. That's terrible to say, but I have. I'm also going to make a recommendation that you shop around for the best price on medical tests and procedures. If you can do it beforehand, it's great. If you know the billing code procedure, you can check your pricing. There's a site called, I believe it's called healthcarecosts.com. Or another one that I think is healthcarebluebook.com. You can compare costs of your tests and of any treatment within your zip code. People automatically think that medical services are fairly uniform, that the cost and payment for them. And that's not true at all. An MRI, for example, can be as little as a couple $100 to several thousand, like almost $6,000 to $8,000 in the same area. Again, it depends on their insurance and all kinds of stuff. But so you can do research. Yes,
definitely. We have to be researchers. And you're right, detectives. And I also want to comment, Diane, as far as medication, with your insurance or if you have Medicare, prescription coverage, if it's covered by one of those Medicare ones, you have to find out before, do they pay for the medications? Now, I know in my husband's case, they gave us wrong information because he took the generic of the Exxon patch, Rifaximin, something like that. That's the name of it. And they told me it would be covered, and then it wasn't, and I had to appeal it twice to get it covered. So you have to really, we always say this, Diane and I, you have to be an advocate. It's really what it comes down to, folks. You have to be an advocate. Yeah. You don't have a choice unless you want to pay. If you don't want to question and you don't care about paying, then don't be an advocate. But if you don't want to pay, you don't owe, they've made a mistake, why should you pay it? Do you think they're going to be quick giving you your money back? Oh, no. But they sure want your money quick.
Exactly. And there are things that people can do. If you look at your bill and you think that you're way off base as far as the charges, there is a it's called balance billing. And many states offer protections against the practice. There has to be more transparency, and you have the right to dispute a resolution, get a resolution for this. So if you find the balance billed is like a surprise, like you said, $3,000, $4,000 or whatever, even if it's just a couple hundred, I don't care. We're on fixed incomes. The gravy train is not here to take care of us anymore. We're not able to work and make money to make up for this loss. We live Social Security to paycheck to Social Security paycheck. So it's important that you understand that you can negotiate with a hospital billing manager or the doctor or whoever to waive or to lower their fee. And you can do it prior to a procedure, because I've done that. I did this. I was in between jobs. In fact, I had taken time off to help care for my dad, and I took off a year to help him through his death and dying process. I was without insurance because I literally quit my job, as so many caregivers do. This was many years ago. And I developed a Morton's neuroma while I was off. So I had to have a tumor removed, a tiny tumor on my nerve, on my toe removed, because I couldn't walk without stabbing, excruciating pain. This was many years ago. I went to a podiatrist because I was going the most cost-effective way I could find, in office, in a podiatrist's office. The anesthesiologist was going to be there to give me just light sedation. And the anesthesiologist that was there was insulted in the beginning that I would even think to negotiate with him in regards to his rate. And the doctor's office as well. I had to go to their office managers and say, look, number one, I'm negotiating because I know that I can, because I did it for a living. That's what I did for patients. I also knew that cash is king, and I was paying cash right up front for the care that I was being provided, so they weren't going to have to work 60, 90, 120 days out like companies like United Healthcare make them wait in order to receive payment. So I used that as a bargaining tool, and I did get lowered rates, but that was like 20 years, 25 years ago, but they were insulted. But I'm like, get over it, you know. I'm sorry,
right.
I shouldn't have to pay this rate. Not when I'm giving you cash the day of. People have to just have the chutzpah to negotiate.
Yes, definitely. Maybe your doctor might write off a balance. Here in New Jersey,
Yeah.
I highly doubt it, but they might. Or for surgery, I know with this insurance I have to pay 20%. I keep my fingers crossed that nothing happens to me because I can't afford to get.
Yeah.
It's really that close to health care, and that's a whole other topic, should not make somebody go bankrupt or homeless. And,
it happens.
You know,
I think that free Medicare for all is going to solve that, and I will tell you right now, it is not. Because what's happening in our situation right now in our country is Medicare is providing less and less for us and expecting us to pay for more privately, like you're doing, privately pay for care that we need or want or deserve, or have it in a timely fashion. What we're seeing in the other countries that have universal health care is the rich privately pay for care, and they jump the queue and get the timely treatments and diagnosis and tests done. And everybody else in the national system is delayed because, again, cash is king. And if you can privately pay for something and pay full price, which is what's happening, they get seen first. In the other countries, those that purchase private health insurance outside of the national or universal healthcare system also jump the queue. So you could be a person that needs treatment, but if you're with the national health system and you don't have, or the free Medicare for all system, if you're not able to privately or have your own private health insurance, then you also get delayed. I will tell you right now, I've seen this for the last 50 years in healthcare. Medicare is providing less and less coverage for us. And Medicaid, if you're on Medicaid, if you're in a teaching hospital, you get the absolute utmost top-of-the-line hospital care that is provided, available, because they're able to teach and they can have government write-offs and stuff. But when you're discharged and you need equipment or medications, or you need even to be placed somewhere, your options are so limited because nobody wants straight MA. That's what they call it, straight MA. And nobody wants straight, just plain Medicare without a supplement. So your options are limited. And that's why we're seeing more and more doctors going to concierge services. Yeah. And in your area, Betsy, right now, you're even seeing nurse concierge services. Nurses are providing services for private pay patients because insurance companies are not providing coverage for services. And our unpaid family caregivers are unprepared and uneducated in regards to the healthcare procedures that they're expected to perform on their family members every day.
Yes. Speaking of concierge, my mom's first doctor down where she lives went that route, and she changed to someone else. She had to pay, I think it was almost $2,000 a year, and then I don't know if visits were extra, but she said no.
There's so many visits a month or a year that you're allowed to have with that. But that's the wave of the future, because we're going to have to pay more and more privately for our things. We're already paying for our medications out of pocket more and more. We're also paying for durable medical equipment is not available. Wheelchairs, walkers, that type of thing, which was once covered by Medicare, is now expected to be private pay. And people don't understand that or realize that. They really don't. They think that when they think Medicare is going to cover everything, and it really doesn't. So I'm really excited that we have this conversation today, because it's going to be a situation that is going to creep up on people more and more. You have to be able to know that you can fight to get coverage, or at least negotiate a lower rate. But don't hesitate to do that.
Yes, Diane, I have to say this also. In my area, more doctors are going into practice with a healthcare system. So you will be billed as if you're going to a hospital. So you'll be paying more. And this is going on here in New Jersey. I don't know about anywhere else. The doctors are not happy about it.
It's nationwide, and the reason why it's happening is doctors can't survive with Medicare reimbursement and maintain their practice and maintain the staff needed to meet the government requirements of all the pre-authorizations and all this stuff, knowing who's in, who's out, who's not. So we're moving more and more to where there's going to be fewer physicians offering services outside of a hospital system. It's just going to be the way it is. Private cases are
that's very true. My endocrinologist, her son just finished his residency, and I said, "Are you going into private practice?" He told me it is very difficult now to open up a private practice. It's like almost impossible. You have to go in with a group or in with a hospital care system. No more doctors on the corner opening up their practice anymore. That's just not going to happen.
And the other thing that's happening is because we have the reimbursement rate has been so low for Medicare and Medicaid, teaching hospitals are closing all over the country, so that we are going to see a shortage of doctors. We already have a shortage of specialists, dermatologists and neurologists and neurosurgeons. We're seeing a shortage of those because there is no place for them to receive internships, residency, and fellowships for their specialty. So we're already seeing that. I'm in Myrtle Beach. The healthcare system is not able to keep up with the growth here. And people are having to go 2 and 3 hours to the bigger cities to receive the level of care that they need. I can't even imagine what the rural areas are doing. It's got to be hard for them. So telemedicine, I hope, is here to stay.
Yeah, I hope so. I'm fortunate we're in my area that I am by a large teaching hospital and other hospitals. It's a shortage. And with nurses, because the average age of a nurse and doctor is probably in their 50s or 60s, and they're aging out, and they're not putting up with this bull crap that the government system. Look at the whole show. The healthcare system.
That's a whole other call.
It's broken.
We keep these long-term politicians in way too long, and they have not done anything to improve, but only to bring harm to our citizens. But on that note, I think that I'm so glad we had this conversation today. I'm very blessed that it was a very appropriate topic today, because I did get a call about it, in fact. So, Betsy, I'd like to say thank you very much for your time. To my caregivers out there, remember, you're the most important part of the caregiving equation. Without you, it all falls apart. So please practice self-care every day. Learn to be gentle with yourself, because you're worth it. Betsy, until next time, have a good day. And stay dry.
Yes, I hope so.
Right,
thank you, Diane. Bye-bye.
Bye.
Bye-bye.